Dear participant, welcome to the Comment online lecture for Unit 2, Motivation and Identity. My name is Juliane and I'm going to guide you through this module. Please note that this module is based on the actual slides of the training content, but for the online lecture today we are going to only pick out a few of those slides and apply them to more practical examples. We will start off with some of the actual training content. And first of all, there's the question, what is care? As you already know, Comment is aiming at a better care for people with mental health difficulties, but that is easier said than done. Because first of all, we have to be clear about what care actually means for ourselves personally, and then we can apply it to a project later on. So let's start off with a definition of care. There's one definition given here in this program, and that states care, rather than a particular activity or group of activities, is a way to address the activities arising from the consciousness of vulnerability of self or others. However, we understand the care as if it were a group of specific activities that require a certain emotional state of consciousness. So as you can see, this is quite a broad definition. It's quite a holistic view on the concept of care. There's also a different definition from the 1990s from Carol Thomas, and that definition states the following. Care is both the paid and unpaid provision of support involving work activities and feeling states. It is provided mainly, but not exclusively, by women to both able-bodied and dependent adults and children in either the public or domestic spheres and in a variety of institutional settings. So as you can see, this is a different definition, but both definitions basically say that it's also a state of feelings, so it depends on your own approach or emotional state, the way you actually provide care. So let's start from the premise that the knowledge of others' needs is of course only possible if you're aware of your own needs and vulnerabilities. It is important to establish a kind of baseline on what you think about care, what you think about mental disorders, and about your role in all of this. There are a lot of nice exercises within this module for you to generate some kind of reflection and to ask yourself these questions. We will not go through these activities here within this lecture, because this is just an add-on to the actual lecture. So what you should do and what is suggested is that you do the lecture first. So you go through all the slides and then this is supposed to be an add-on to the actual slides. Here you can see that there are different systems of care. Of course, there's the household system where care can be paid for or not. And it's of course usually done for the family and mostly by women. And then apart from that domestic system, we have of course the non-profit services of care on the one hand. Here you can see the different types, and there's also profit services, which is basically all the professional services of care that you pay for, or for example your health insurance pays for. And of course psychotherapy, for example, is a special kind of care, special kind of mental health care. Here again you can see the context and types of care, and as I said before, there's care that is paid for. It can be either be provided in a public or private service, more formal or informal. And of course, there are the two ends of the actual carer and the person that receives the care. And especially the last one will be important here. This is a really nice task for reflection, and it is asking you to make a list of people or professions that you think take care of others, and you're asked to explain the reason. So it would make sense to go back to the slide that shows you the different levels, so the context and types of care. For example, is the care paid for, or is it not? Is it public or private? Is it rather formal or informal? And then apply those to the concept of mental health care. So here try and think about who takes care in the field of mental health. That obviously depends on your country, but just as a hint, think about all the professions that are involved in mental health care. For example, different kinds of physicians, psychiatrists, for example, or psychotherapists, social workers. And then think about the context and which kind of care they provide. And that will give you quite a good overview also to see who is involved in mental health care in your country maybe, and who you could possibly involve in your project later on. This is a nice overview of the different dimensions of care. So all these factors depend on what care actually looks like in the end. So it will of course depend on your own social identity and the social identity of the person that is cared for. Also, of course, the relationship that you have with the person that you care for. There might be an emotional bond beforehand. It might be someone you know already. Of course, there's this private dimension that you would care for friends or family members, of course. But then there will be, of course, a different relationship when you provide care in a work context. There's also the social context. So will the care, whether the care is provided in a public sector or private sector. And that will also depend on the economic nature, of course. So if the care is paid for or not. And then also, where does this care take place? Is there an institute or private practice, for example? All right, so after we had a quick look on the concept of care, we are going to move over to the social intervention and social enterprise. Here, because this in the end will be the frame and that we will provide care. And of course, social intervention starts with the diagnosis of a problem and involves the search of solutions. And one of the basic concepts of the social intervention is the perception that there are some needs that are, of course, not satisfied, and you have to look for those needs. So think about deficits, lacks, deprivations, or risks that exist around you. And in order to make that a bit easier, we will have a look at a specific mental health problem, and we are going to apply the different steps and some of the tasks within this module on that problem. We are going to have a look at depression And first of all, there's a little video that was produced by the European Alliance Against Depression, and that will give you a short overview on the burden of depression.
You think you don't know anybody with depression? You are probably wrong. Depression can affect anyone. Around 20 million European citizens suffer from depression each year. Depression is associated with deep distress and is a huge burden to those who are affected. According to the World Health Organization, depression is one of the most disabling disorders in the world, affecting roughly 1 in 5 women and 1 in 10 men at some point in their lifetime. Each year in Europe, it is estimated that 7% of people experience an episode of depression. Depression can affect anyone. Men and women of all age groups, educational levels, and social and economic statuses suffer from depression. Depression is a real disease. All areas of life are affected and compromised when depression is present. Family, parenting, marriage, dating, making friends, work, studying, careers, and finances. Depression often reoccurs after an initial episode and can become persistent or chronic if left undiagnosed and untreated. There is a close relationship between depression and suicidal behaviour. A substantial number of depressed people die by suicide, and many more engage in non-fatal self-harm behaviour. In the European member states alone, each year 60,000 people die by suicide, compared to 50,000 by car accidents, and more than half of those suffered from depression. According to the World Health Organization, approximately 1 million people worldwide die from suicide every year, and the rate of attempted suicides is approximately 20 times higher than this. Due to the close relationship between depression and suicidal behaviour, it is envisaged that preventative actions which improve the care and optimise the treatment for depressed patients may contribute to a reduction of suicidal acts. Access to prevention and treatment of depression is a challenge for Europe. Depression can be treated. The European Alliance Against Depression is an international, non-profit organisation targeting better care for people with depression and the prevention of suicidal behaviour. More information can be found at eaad.net. If you don't feel well, seeking help is an important first step. Information, self-management, and help addresses in more than 10 European languages can be found at ifightdepression.com.
Okay, welcome back. After having watched this video, we are moving on to the slide on social intervention, social enterprise again. And this is about investing in a problem. So of course, after you have figured out the problem, we could stick, for example, with the topic of depression and suicidal behavior. It is not just about pure investment and creating and generating ideas. It is also about empowerment. So giving tools to people so that they can believe in the possibility of improvement and feel ownership of their reality. So basically, of course, informing them about, for example, the burden of depression and how prevalent it actually is, and that it is closely related to suicidal behavior, as we have just learned in the video. And then the next point is introspection capacity. So to actually inform people about the symptoms of depression, the evolution, and their actual real situation. So the situation of, for example, the patients suffering from depression, but also relatives, the broad public, and to make clear what the problem is and to reflect and make that problem visible to everyone. And there's also a different point of treatment compliance. So that is the actual adherence to the treatment that would apply more to the patients, for example, suffering from depression, and their adherence to, for example, antidepressants. So basically what we are talking about here is education for health. So let's have a look at this one point here, adherence and treatment compliance. And there's some really interesting findings here. Some data from different studies that have been conducted. And they show that around 30% of patients do not follow their treatments, and 70% breach prevention programs, which is a really high number. And also more than 50% of chronic patients do not adequately meet all the conditions of treatment. And also, and most importantly, only 20% of health professionals successfully adhere to medical treatments. There's a short video that you can watch here. But we are going to move on to the definition of adherence and treatment. It is the commitment to active cooperation of the patient and deliberate in a course of conduct accepted by mutual agreement in order to produce a desired preventive or therapeutic outcome. So, of course, there are patient-related factors that influence adherence and treatment compliance. And for example, and as you can see here, adherence is influenced by the knowledge and beliefs of the patient about their illness and the motivation to treat it, of course, expectations of self-efficacy and outcome expectations, and of course the cost-benefit value attributed by the patients. So it is of course important if you say that of course patient knowledge and beliefs are important, that they are well educated about the illness, that they know what symptoms there are. And so here again, if we work with the example of a patient suffering from depression, it is of course important for a patient also to gain knowledge and beliefs. Happen through psychoeducation, for example, which is really often applied in patients suffering from depression. And that will result also in motivation, of course. But for depressed patients, it is often a struggle because, for example, hopelessness or plain negative perspectives for the future are part of the illness. So that will also result in a lack of motivation, for example. And also the expectations of the outcome might be low here, because also in line with the illness here, expectations are normally low because the patient believes that no one can help him and it is all his fault, basically. And also it is important to gain cost-benefit value for patients suffering from depression as well, and also to make clear how, for example, antidepressants work and what side effects there are and when they can be expected to go away. And this is all really important for the patient, of course. So after this little excursion to care and treatment adherence, we are going to move on to creativity and innovation. This will be the next step. So after having figured out our problem and problem that we would like to work on, and maybe the frame in which we would like to set up our project, and also what care means to us, it is important to work out some ideas and also concepts on how we can help people. In order to work creatively and innovative, we can set a good baseline with this task that is called responsiveness to needs, other needs. And it is asking you to go through these questions with someone else in order to see what kind of steps there are to approach someone else's needs. And to stick with the example of a depressed patient, we could go through these questions with someone who is depressed, for example, and ask him, what do you not want anymore? What would you like instead? He might answer, for example, that he would like to go back to his normal self and the way he was before he became depressed, and he would like to be able to sleep well again. If we would ask the patient or client, why do you want that? He might answer that of course he would like to go back to work, for example. And what has to happen to come through? He might say, well, I should get treatment. And what would be the first step? The first step here could be, and with any other mental health disorder as well, to make an appointment with a GP, a general practitioner. Once you know your own needs, and once you know the needs of different target groups, it will be much easier for you to help someone else. And also, it is good to ask someone else about their needs, because that will also help you to find out what the problem actually is and how you can help. And then, of course, you have to figure out, after going through these questions, what kind of resources are there to help people, and how can I provide those resources within my project, for example. Let's get on with a more practical example about identifying outcomes and working creatively. And there's one slide here that is asking you to have a look at the EAAD model. It is asking you, please have a look at this program and explain what they wanted to achieve and how they wanted to do this. And we are going to go through these tasks now together. EAAD here stands for the European Alliance Against Depression, and we are going to stick with depression. So after having watched the video some minutes ago and already having a background knowledge on depression and suicidal behavior, we are going to have a look now on the webpage of the EAAD, which is www.eaad.net. It is an international and non-profit organization which is based in Leipzig in Germany, with several European members and more than 100 regional network partners in Europe. And the main aim is to improve care and optimize treatment for patients with depressive disorders and to prevent suicidal behavior. And in order to do this, several community-based 4-level intervention programs have been applied to countries and all over Europe. And what does 4-level approach mean? Let's have a look. It is basically one level that is dealing with primary care and mental health care. So cooperating, for example, with general practitioners, because those are the ones who see most of the patients first and they can diagnose the depression. There's also one level dealing with the general public. There have been large depression awareness campaigns with posters and leaflets. And of course, the level of community facilitators and stakeholders, which basically means that a lot of workshops have been offered and are offered in those countries for teachers, for example, for police. So any kind of community facilitators that are in contact with people and also in contact with depressed and suicidal individuals. And there's of course the level dealing with patients and high-risk groups and relatives. So the alliances against depression work closely together with self-help groups, for example, and they do offer a variety of activities to relatives. In order for you to have a better understanding of this approach and the different levels, we are going to have a look now on how this approach, the EAD model, has been applied practically in one of the countries, in Hungary.
So what's actually happening on the ground? We went to Budapest to see an example in the field of prevention of depression and suicide. In the early 1990s, the socio-economic situation created a lot of depression in the population. As well as the stigma attached to depression, what makes things worse for people in a fragile mental state is the lack of information and networks to deal with it.
Rendkívül súlyos egzisztenciás problémákkal kezdődött. Én akkor még nem tudtam, hogy ez micsoda, csak azt tudtam, hogy nagyon-nagyon nem én vagyok, és nem szóval rosszul érzem magam, és különböző problémáik úgy lelki, mint fizikai problémáim is sorban jöttek.
Nagyon fontos a Magyarországon a depresszióról való ismeretek oktatása, ezt mint pszichiáter is mondom, hiszen nagyon sokszor látjuk azt, hogy mire a betegek megfelelő kezelést kapnak, addigra már 100 helyen is jártak.
The issue is clear. It's vital to spot depression quickly to treat it effectively. It was with that in mind that the Semmelweis University in Budapest joined the European Alliance Against Depression, a network built up with the support of European public health programs and which brings together 17 European countries.
Az EAD program Magyarországon 2004-ben kezdődött, az egész EAD 2004-ben kezdődött, és Magyarország már az első körben csatlakozott hozzá. Ennek a programnak az elsődleges célja a depresszió felismerésének a növelése, illetve a depresszió destigmatizálása volt.
The European Alliance Against Depression works on 4 different levels. First, training for general practitioners to be able to diagnose depression quickly. Secondly, advertising campaigns which are broadcast regularly. Thirdly, support and supervision put in place for at-risk groups. And finally, training of social workers such as priests, police officers or teachers to help detect depression at a much earlier stage.
Rendszeres tapasztalatcsere, amikor a különböző tagországok a saját helyi tapasztalataikat megosztják a többiekkel, akik ezt aztán igényeik, illetve lehetőségeik szerint a saját programjukba beveszik, amennyiben ez az egész EAD koncepciójába is beleillik.
Welcome back. I hope now you have a better understanding of the EAAD model and I could help you to work through these exercises. So as you can see, activities within your project and also activities in mental health care can have different levels, and it makes a lot of sense to combine different levels in order to reach one or more goals and to bring people from different backgrounds together. And obviously this can be applied to different problems. We were dealing with depression and suicidal behavior within this unit, but of course based on whatever your idea is, you can think about different levels, for example, for an approach. Alright, so we were dealing with different issues within this lecture. First we started off with a concept of care and your own perception of care and how you can help others. And we were also having a look on identity and motivation and what actually is social enterprise and how can you develop ideas, all based on an example here. And I really hope that this will trigger your working process and you can start developing an idea. And I will leave you to it and finish off here with a task which is really helpful for you to develop an idea and generate different outcomes and solutions. And that is quite simple, building a mind map. So good luck with being innovative and creative, and see you in Unit 3.